when shoulder pain lasts for more than a few days and doesn't get better with just your regular over-the-counter anti-inflammatory, and it limits your function, so your ability to raise your hand in space or your ability to put things away in the cupboard or things that affect your activities of daily living, that's when it's time to go see a doctor to have it evaluated.
What are your most common shoulder injuries this time of year?
This time of year, most often the injury is a rotator cuff tear. Usually that involves a tearing of the muscle that helps keep the ball and the socket together. But more often those patients notice that they've lost something with respect to function. Inability to put their hand over their head, weaker when they're throwing the ball, and pain that usually lasts at night. So night pain is a big signal that you have a rotator cuff tear.
Is it a burning? Is it a piercing? What kind of pain is it?
It can be different, but it usually localizes to the outside of the arm. It's not always up on the top of the shoulder, it's more on the outside. So it can be burning, it can be deep pain, but as long as it localizes to this outside of the arm, that's more typically the rotator cuff.
What would it take to fix that?
Well, it depends. It depends on the patient. Some patients, if they have what's called an acute tear or a tear that pulls off the bone after an injury, those patients would have to have a surgery to fix that. Some patients who may have a chronic tear, it depends on the patient, depends on their age, and depends on their current function level, but sometimes therapy can be of help, an injection, anti-inflammatories, and maybe surgery if it's warranted.
Do I need a doctor's referral to come see you?
No, absolutely not. You can just call our number and get an appointment anytime.
Cool.